Hey all, I am PA Clarke. We're back here for our Makeover series. And today is going to be a treat because we're going to be speaking with Nev. Nev, how are you doing?
I'm doing well, thank
Great,
you.
great. Okay. What brings you to me, Nev? Yeah, I'd like to dive right in. What brings you to me?
So I'm recently started noticing that there's certain like dehydration in my face,
Got it.
and there's very deep pores.
Got it.
There's also lots of lines, and I just kind of want to start taking care of my skin better.
Got it.
In the profession that I do,
Yeah.
guys usually don't take care of themselves at all.
What environment are you in with the profession you do?
So I'm a controls engineer, which we deal with heating, ventilation, air conditioning systems.
So you're in the elements most of the time. You're
Correct.
outdoors when it's
Yeah.
winter and the dry air. In the
Yep.
summer, it's the heat. And so
Right,
forth.
and when it's raining, we're out there, and so the the skincare is basically non-existent. But in general, our job is so like hectic that we don't really drink enough water. We don't.
Right.
So
None of us ever do, right?
right,
None of us ever
right.
do. Yeah. And when did you start noticing some of these issues?
So only recently, I kind of noticed like when I wake up in the morning, everything looks sort of normal, but then by the end of the day, like right as the day moves on,
Right,
it just
right.
gets more and more dry or dehydrated, and then the lines just become more and more prominent.
And what kind of skincare routine do you have?
So currently, I kind of use serums and like night masks, and then just cleaning every morning and every night before going to bed.
Have you always done that, or only after noticing
God.
those changes?
No, so I'm 37 years old. I
Okay.
started doing my skincare routine 2 months ago.
2 months ago.
So
Wow.
37 years worth
Yeah.
of.
But can I tell you, I started myself in my late 30s. I think around that mid-late 30s, men in general
Wait,
started.
I'm sorry, late 30s?
30s, yeah.
And you are 27. How does that work?
It was great.
You look great. I mean,
Don't feel bad, but
this
yeah,
is
it was great.
amazing.
Thank you, thank you. In my late 30s, I started with my skincare stuff. I started doing my Botox a little bit. I spoke to my wife several times. So, should I start to, and at that time, even though I was administering these products on my patients, I was still weary as a straight man doing this procedure on myself. And is that a worry that you have?
Well, it's not a worry, but it's just something that I guess in my field or like the people that I'm around, they just don't feel like you should, and they don't feel like it's a actual thing. It's an actual concern,
yeah.
and so. The older you get, you just kind of start realizing like what is happening. Like,
That's right.
I want to look better. Like,
But who doesn't want to look better?
absolutely.
I tell you, skincare is one. Skincare is something that works amazing. It keeps the surface layer hydrated and youthful, which means that the skin cells don't flake off. You don't damage the skin. The trauma to the skin isn't as much. Having the sunblock on and that is very important also. But when it comes to the creases and the creases and lines increase the visual aging.
Yes.
Visual aging on the face, anywhere there's creases or lines induces age. And depending on the depth of the crease or the line, that age can be exponentially increased. You can have individuals in the 20s and they look like they're 40s. I just turned 51 and I have individuals who my age and they look like my father or my grandparents. So it's all about the skincare. Every person wants to look good. Most men don't know where to start or
Yes.
are uncomfortable in discussing this topic.
I would totally agree, and I think the bigger point of that is where do you start? It's so overwhelming. There's so many products. There's so much different, I guess, information floating around on the internet, and so you just get really overwhelmed really quickly.
Right.
And this is where you need a
Right.
friend.
Not only that, but you walk into a CVS or a drugstore, you never really see a men's section for for skin. So you have to go into the female section. So as a straight guy, you're walking to the female section looking at female products to put on your skin. Of course, it's gonna feel.
It feels a little bit, it feels a little bit weird, and you're like, is anybody looking?
That's right. And that is an inhibition for us to take care of our face. Plus, at work, you don't sit around, lunchtime, you're having, you're eating, and you're not talking about your skin. You're talking about other things.
Yeah, absolutely. Absolutely.
Okay. What is the one thing you want to see achieved on your face today?
I would like any kind of help with the lines that are happening across the forehead. There's one specific one, like right here. It's wildly deep. It looks absolutely insane. Okay. So any form of help would be just phenomenal.
Now tell me, in terms of your look, when you look in the mirror and you see the shape of the face, what is it that bothers you the most in terms of the shape of the face? Not necessarily the skin this time, because we did the skin already, but the shape. Are you happy with the shape? Do you like the shape?
So I've always felt, and I don't know if this may or may not be true, but the chin is just weak. I have no idea what goes on over here.
Right.
Something's happening, but it's just barely there. And that is kind of sort of the biggest thing that's like, man, I wish that it was a little bit more prominent or a little bit more, out.
Do you feel that you've lost some of the definition in your face from more of a rounder, fuller?
Yes. Yeah, absolutely.
Would you rather have more of a chisel defined face feature?
Yeah. That's kind of like my go-to look, like a little more pointy, if you will, or a little more angly.
Yeah. Is there a reason why you have the beard? Is it you like the style, or do you think it kind of
love some of the things? Correct. Love hiding the chin behind the beard. If you grow it out, I mean, it just looks a lot better. Okay. So it just, like I said, always felt like the chin was a very weak chin. Right. So that's kind of like psychology why the beard comes in. So
if you agree with my proposal on the reveal, which necessarily isn't going to be today, because some of the things I would like to do for you would require at least maybe a full 2 weeks for me to on that photo. That reveal, I can give you a much more chiseled, defined lower face with a stronger chin, and also removing the lines and the creases and so forth, which means we can knock about maybe 10 years off what you're seeing now.
Wow.
100%. But we'll talk about that in reference to what I would need to do, and and after I discuss this in full detail, and you do agree, we'll do that, and if we can do it today, we'll do. Now let's talk about lower face. Upper face we've already addressed. The under eye hollows, yes, we're definitely gonna address that. The weak chin in this region here, what's happening is you're getting some fall back and some fullness projecting coming out, which makes the chin look even flatter. So from the side profile, you kind of go in as opposed to either straight or going out a little bit. We definitely will use the most amazing products that last a tremendously long time to improve the strength of the chin, but also your mandibular angle. This angle you've definitely lost. This happens in the 30s for most men. They start to lose that sharpness. And therefore, with the techniques that I employ and use, we can get you back that nice straight definition in that jaw. I guarantee you're probably not gonna do too much of the beard, because you're gonna like to see the way your face looks.
I kind of always wanted to. I don't particularly enjoy the beard, but like I said, it's just a thing. Like it's a security blanket, sort of.
Absolutely. You
put it on. That's it, right?
All right. So Nev, let's end the consultation now. I know exactly what I want to do for you. We will list all the things that I've done for Ned within the comments of the show, so you can see the amount of work that went into it. It's not a lot of work, but it's the precision work that's necessary because we're dealing with people's faces, which means we're dealing with the psychology of the individual and how they feel about themselves, and we cannot screw up by not knowing exactly what we need to do for this individual. So Nev, you're gonna have a wonderful result, and in the 2 weeks we're gonna have a reveal of everything, and yeah.
Hopefully in 2 weeks I can just shave it off and then it'll be just
right.
nice.
Okay. Nev, my pleasure.
Thank you so much.
Absolutely. Hey y'all, we're back in our treatment room with Nev. Nev, welcome to the second part of our Makeover series. Are you ready?
I am ready and excited.
All right. Okay. We are going to work, just to recap, we're working with Dysport neuromodulator on the forehead and the glabellar zone. So Nev, raise your eyebrows for me. Very good. We're working on this, and relax. Now squeeze angry for me. Yes, absolutely. We're going to work on the glabellar zone. We're also going to work on the tear trough. And if you notice, we have that hollowing and slightly on the cheek as well. So we're going to open these areas and just create a more youthful upper face. Last but not least, we're going to work on this jaw angle. So Nev goes in pretty much. I can feel his jaw angle, but I can see some red tides on the side, which tells me that there's a lot of volume loss occurring in this region. We're also going to push this chin out a little bit more because it has definitely gone on sunkening. So between these changes, definitely we're going to take Ned back to a younger version of himself. If you're ready and you have the guts for it, we're going to start this procedure. There should be little or no blood, little or no pain. It's going to be very gentle. My hands are very soft. Let's get going. Okay, now I'm just going to make some markings, eyebrows up again. Alright, we can start the first session, which is going to be the Botox or the Dysport. So that was the Dysport or the neuromodulator or Botox part of the procedure. How was it? And it wasn't that bad.
But
Right?
wasn't bad at all.
Very good.
Barely felt anything.
Now we're starting the under eye tear trough treatment. And what this does is identifying the structures that has the deficits, increasing the volume and the height, and reducing the trench or the depth of the tear trough that occurs under the eyes. Next will also be the cheek. So this is a combination of cheek and under eye tear trough. This one I'm not gonna feel it. Some of us are in awe. This good. But now this is going to be defined for the cheeks. Now what I'm doing, I'm just making sure that my product is in exactly the right place or position that I placed it. Very good. Very. So all fillers are not the same, and depending on the science of the filler, the G prime, the cohesivity of the filler, but also the swelling and the water retention of the filler, these fillers must be placed at different levels within the face. All fillers are not the same, and you cannot inject all fillers the same. So you should never have a provider who's only using one product for your entire face. Very good, perfect. Looks great. We're just about finished with this region. So Nev has undergone the first half, which is the upper face, which is the toxin on the top, on the eyes, cheeks. Now we're working on the chin, and then lastly the mandibular angle. Ned, how's everything so far?
Everything has been great so far. Yeah, absolutely.
You're not passing out on me or anything?
No, not at all. You can barely feel it.
All right. So very important of note here, I don't have to send Nev home to shave to do the treatment. I can see exactly where I need to go. Many times that comes from experience, but sometimes you just know where it's necessary for the improvement and the lift for the filler. In this case, we're using Restylane Define to really kind of define his chin. There's a lot of loss of volume, and this is mostly genetic rather than age. This is the second Define that we're using. Sometimes it can require up to 8 syringes in the face. I've had patients where I've injected 10 and 15 cc's, 10 to 15 syringes. It really depends on what you're aiming for. Not every person's the same, and some people require just a little bit more, others require a little bit less. Last, now we're going to work on this angle, which is the mandibular angle, where we're going to pull this out, creating more definition for Nev. Because Nev has this beard here, I have to feel for the depression, and from that I can tell exactly where I need to go in order to create that jawline that's very appealing. So this is radiance, which is a biostimulator. This biostimulator works wonderful in terms of getting a stimulatory effect of increasing the number of collagen fibers that's necessary for the filling effect. What we're doing is this area has a lot of muscles. So one of the strongest muscles in the face is the masseter muscle. So this is the area that we're building up slightly behind and above the muscle to reestablish this jaw angle that was lost over time. And typically in men, around mid-30s is when we get that loss of angle. Okay, we're just about finished. Post-treatment care, the only thing I ask and demand is that you don't sleep on the face. Sleeping on the face is going to change the overall outcome and results. In reference to exercising, you can exercise today, tomorrow, you can do all of your normal activities. My only restriction is sleeping on the face. You don't require medication, you don't require a face mask, there's really no work on your part. The only thing you'll remember is you're not going to sleep on the face. Alcohol, 24 hours, no alcohol. Alcohol tends to increase the chance of bruising. I don't see any bruising that's going to occur here. However, if Nev decides to drink alcohol, that can change the outcome. However, there should be zero bruising. The number one thing you should always remember is that you do not want to leave your office bruised, excessively swollen, or having a traumatic face, because you're going home to your family members or you're seeing your friends and you don't want to be ridiculed. This is a psychological harm that sometimes we place on patients. So what we don't want is the patient to look worse than when you came into the office. You must always look better. So I think we achieved this, right? Awesome. Did you see that? Did you see? This is great. Nev, you're gonna love this. Perfect. Don't do anything with it. Don't massage it. Nothing at all you have to do with it. It just looks wonderful.
Awesome.
Okay. And so we're gonna have our intermediate reveal, and this is just a 5 minute after. The real and true reveal is that 2 weeks after, when everything has healed nicely. So Nev, I give you the mirror.
Okay.
So you can take a look and see, and let Nev know when he can look at the mirror. All right.
Ooh.
Yeah, you see that difference, right?
Wow.
That is complete youth that rushed right back into the face.
The under eye thing,
Yeah.
sorry, is crazy.
Yeah, incredible. It's great. I also enhanced the cheeks to some degree, definitely the under eye, but we also pulled this out a little bit. It kind of really sunk really deeper
really
than it thought.
yeah.
Yeah. So that was pulled out, and if you look at this definition on the side, you'll find that it's nice and straight, and now you're not curved in on a slant. Really nice and straight. Perfect.
Big difference. Wow.
So within the next couple of days, within the next 24 hours, it will get swollen. Usually you're gonna look like Popeye or Quagmire on Family Guy, you know, not always a bad thing. But after 24, 40 hours, the swelling goes down, you're gonna be quite fine. Under eyes, you're gonna look as though someone punched you under the eye, meaning that you're gonna have some swelling. You shouldn't have any bruising, but you can have some swelling within the first 24 hours. Within 48 hours, maybe 3 days, all of this swelling goes away. Everything goes away. So this is really an atraumatic procedure, atraumatic technique that I use to accomplish this on you today.
Awesome.
All right, and this is my trademark diamond touch technique that gives atraumatic results, leaving your making your patients leave better looking than they came in on that day. Always important. Bye for now. Hey guys, welcome back to our makeover series with Nev. I am PA Clarke, and this is the 2-week follow-up on some of the work that we had accomplished in reference to having fillers done and having a little bit of dye sport Botox done. So the areas that we worked on, before I ask Nev here how he's doing, I just kind of want to jump into what we did before. We're going to see some before pictures up on the screen somewhere, but this is what we actually did. Forehead, glabella zone, which is that frown line. We did some of the crow's feet with a little eyebrow lift, and with the filler, we went right into the chin area to kind of pull the depth back out. Over time, we all get hollow, we all get deep. So Nev had very, very deep hollow just next to the marionette line, but just above the chin, which kind of made Nev subconscious about the way his chin looks. If you remember, I think on Nev, on the initial consultation, you mentioned that your chin
is just very weak and kind of very small.
That's the word I was looking for. Nev said he felt his chin was weak. How do you feel about the chin now?
I think it looks much better,
much
it's
better.
definitely different.
Absolutely.
And I don't think it's so noticeable so that like other people can just be like, whoa, what happened?
Yeah.
You know,
very natural.
Very natural, yeah.
All right.
Absolutely.
So now let's jump into what we did earlier, and then we're gonna follow down on the face. Nev, raise your eyebrows for me as high as you can. So there's really no movement here. This is a 95% relaxation of the forehead frontalis muscle. Squeeze angry for me. There you go. There's again 95% no movement. So there's a 5% movement, which allows Nev to still have a natural look and not have a surprise or blank stare. And big smile for me, Nev. Very good. On the sides, it's baby smooth. So Nev again has that silky softness on the face. But more than anything else, when I walked into this room today, you look more relaxed. You look like you just came from vacation.
A little bit, yeah.
Very good.
Feels that way too.
Feels that way. So now let's look at the fillers. The fillers, as we discussed, was within the chin region, but then we came back on the edge of the jawline. Now, some people want that hard cut shape. That's not for everyone. If someone wants a more natural jawline, then this is what a natural jawline looks like. Take a look over here now. There you go. So you can see that's natural jawline through the beard. And you can look back at the camera. And we use radiance. Radiance is a calcium hydroxyapatite product. It causes some swelling. Nev, how much swelling did you have after the procedure?
I wouldn't say it was really bad, and it only lasted maybe 2 days.
Maybe about 2
so like
days.
that day, the next day, and then half of
half of the other.
Yeah, so like a day and a half.
Like
let's
a day
say.
and a half.
Yep.
So it comes in very natural. I love radiance, calcium hydroxyapatite, but we also use Restylane products within the chain, and we use Dysport for the relaxation of the upper face muscles. Thank you again for joining me on this 2-week follow-up makeover series with Nev. I love the results. I am sure that Nev loves the results. Nev, if there's something you can tell anyone, any guy out there who's looking to have work done and is still afraid, what would you tell them?
What I would tell them is it's definitely wholeheartedly worth it. It's definitely worth to take care of yourself, and you will feel better. And when you feel better, you kind of just radiate positivity. So I would definitely suggest to all the guys that kind of feel weird or ashamed about it, it's definitely worth investing in your personal look.
There you go. If you're in the New York City area, come and check me out. We'll talk, and I will definitely make sure that you leave here looking 100% better. Thank you again. Don't forget to click subscribe to get more information from us, to see some more of these awesome before after makeover series with myself. I am PA Clarke. Thank you.